The Select Subcommittee on the Coronavirus Pandemic will come to order. I want to welcome everyone here today. Without objection, the Chair may declare recess at any time. I now recognize myself for the purpose of making an opening statement. Today, the Select Subcommittee is holding a hearing to examine the future of the World Health Organization and our relationship as the United States with the WHO. The World Health Organization is supposed to be the preeminent organization that governs just that, the world's health. It played a key role in eradicating smallpox and significantly reducing the cases of polio around the globe. And yet when the world was faced with the outbreak of COVID-19, the pandemic, we saw that the WHO does not always serve all of its members equally. We saw it's not an organization that serves all of humankind, but instead perhaps an organization that became beholden to or entrapped in politics. When it was most essential that the WHO be able to step up and help everyone, it seems to have bowed to political affiliations over global public health. When the WHO should have been conducting independent investigations into the origins of COVID-19 and presenting the global community with verified information to help keep them safe, we instead saw that they ignored some facts and parroted back statements that came from the Chinese Communist Party. We saw the WHO deny that COVID-19 was spread via human-to-human transmission based entirely on the word of the Chinese government. The WHO delayed naming COVID-19 a public health emergency of international concern, a World Health Organization procedure that, amongst other things, would have allowed for the procurement and distribution of scarce supplies, all because the Chinese Communist Party told them the spread was under control. The WHO delayed serious measures to counter the global spread of COVID-19 because the CCP was only worried about their own bottom line. When the WHO produced a report evaluating the possible origins of COVID-19, it became unquestionably evident that the entire report was nothing more but Chinese propaganda. Even Dr. Fauci was worried about the report, stating there was a lot of restrictions on the ability of the people who went there to really take a look. I have some considerable concerns about that. The CCP was so entrenched in influencing the WHO's investigation into the origins of COVID that they even contacted me. With unanimous consent, I wish to submit for the record an email sent to me by the Chinese embassy. So ordered. This email from the Chinese embassy is another attempt to interfere with the investigations of COVID. The letter stated, "We express our grave concern regarding the COVID-19 origins hearing. We firmly oppose it." This kind of communication and action hardly expresses a clear conscience. The WHO's lack of independent investigation potentially allowed the beginning of the pandemic to be worse and spread further than it could have been. All in all, we saw the WHO more influenced by politics than public health. Not necessarily their fault. There's no denying it. The WHO stumbled out of the gate. This subcommittee is as much about looking back as it is looking forward and preparing for the future. We must be better prepared when the next pandemic surfaces, and a scientifically focused WHO is paramount to that. It's evident the WHO is in need of some reform. So why not take an opportunity to ask the very people who are in the trenches how we can help them? Why not ask direct sources what we can do right now to equip future generations? Should there be an independent body that is able to conduct oversight? How can the ideal methods of data sharing and development be implemented across the world? What we do know is that the WHO needs to be reestablished with raised expectations of transparency, verifiability, and accountability. Accountability amongst its members as well. Running any public health organization in a political manner destroys the organization's credibility. The WHO needs to police its members and not cower behind bullies. The WHO should have been in a position to tell the world that China was lying, if they were lying. The fact that it didn't do so until later is very telling. Honesty is always non-negotiable, especially during a once-in-a-generation public health emergency. The WHO is currently drafting a new pandemic accord and new international health regulations that will apply to all its members. These changes must ensure American interests are protected. They must not violate international sovereignty, and they must hold China and others accountable. Further, any accord or treaty must be presented to Congress for approval. Anything else is wholly insufficient, especially in the minds of the American people. Let's use this opportunity to ensure that the WHO can actually protect the world's global health and not just the political interests of a few of its members. The United States should be setting the gold standard in incentivizing best practices. And we should be doing everything we can to force the WHO to listen to American interests. Nothing is more important than global public health, and properly reforming the WHO is the first step to that protection so that our officials and our providers can better care for our citizens and establish best practices, not only for here, but perhaps around the world. We're holding this hearing to look at the current circumstances surrounding the WHO and see how we can make it better and stronger for the future. I look forward to a strong on-topic discussion today, and I would now like to recognize Ranking Member Dr. Ruiz for the purpose of making an opening statement.
Thank you, and I believe, Mr. Chairman, that this is the first time we gather after you made your announcement, so I think it is absolutely appropriate to congratulate you on your decision regarding your retirement and to show you our full respect and full appreciation for the amount of service you have given to our nation, not just as a policymaker here in Congress, but also in your service in our military and as a physician. And so as a fellow physician, it's going to be sad to see you leave, but know you're loved and know that you're very well respected, and our nation appreciates you 100%.
And I will miss working with you. And I think we got a few bills we can get passed this year.
We must. It's been a while, my friend. And thank you to Ambassador Nkengasong, Assistant Secretary Pace, and Assistant Administrator Gawande for your participation today. I must say, Mr. Chairman, right now you probably can't see or really feel, but inside I'm like a kid at a candy store. I'm really excited to have all three of you here. All three of you have done remarkable work, have led your profession, and have been thought leaders for our nation and many countries around the globe. So I want to thank you personally. And I also want to give a special thank you to Dr. Atul Gawande, you see, because when I was a third-year medical student doing my general surgery rotation at the Brigham and Women's Hospital, I actually scrubbed in with Dr. Gawande when he was a fellow there. And I really need to thank you for your kindness, because despite you looking like you hadn't slept in 7 days, you were still kind and patient in helping me maneuver around the operating room. So thank you so much. In the last 3 years, the world has preserved through a deadly pandemic that has claimed nearly 7 million lives across the globe. Now, as we reflect on the international response to this public health crisis and look to the future, we must do so with a commitment to advancing global health security. There is no international organization as central to this work as the World Health Organization, which has contributed to monumental advancements in healthcare access, improvements in population health outcomes, and the defeat of deadly diseases, even in the farthest corners of the world. The WHO's continued surveillance of global health threats has helped prevent outbreaks of deadly diseases, such as measles, from arriving on our shores. And the WHO's global vaccination programs have helped contribute to an overall 54% increase in global life expectancy in the last 70 years and put us on track to prevent 51 million deaths from measles and hepatitis B around the world. So, I want to take the time to emphasize now that our work to prevent and prepare for future pandemics is not in conflict with enhancing international cooperation. Instead, our efforts are strengthened and fortified by it. In our last hearing on biosafety and biosecurity, we all agreed that threats to the American people's health do not end at our borders. So in order for us to ensure our nation is truly prepared for the next pandemic, we must continue to engage with the international community on work that prevents future threats from reaching our nation. The United States has served as the preeminent leader in global health for decades, and now is not the time to cede that role to another country angling for global influence. No, now is the time to reinforce the United States global health leadership with meaningful reforms to the WHO that promote transparency and strengthen international cooperation in the event of future pandemics. Thankfully, after years of volatile leadership under the previous Trump administration, the Biden administration has sought to correct course by re-engaging not only with the World Health Organization, but our partners around the world to advance global health and our interests abroad. You see, when we become an isolationist nation, we leave a void that other countries can come in and easily fill to use public health diplomacy as a way of geopolitical dominance. Taking a lessons learned approach from the early days of the pandemic, the Biden administration has pursued reforms to the WHO, and I think we can all get behind. Reforms that, one, enhance oversight of member states' compliance with international health regulations, two, develop an early warning system for public health threats, and three, strengthen investigative capabilities for public health emergencies of international concern. Exactly what we're working on to strengthen. So these reforms would not only institute positive change at the World Health Organization, but they would also enhance pandemic preparedness on a global scale, and therefore reinforce U.S. influence in international institutions and norms. You see, in many ways, global health is the cornerstone of our diplomatic efforts, and we must continue to find ways that enhance our role in this space on the international stage. The fact of the matter is, when we leave gaps, our adversaries will fill them. So now more than ever, we should work to deepen cooperation with our allies and commit to a collaborative approach to global health security that will ultimately counter the Chinese Communist Party and deter their influence. Bold investments in global health and pandemic prevention made through the Consolidated Appropriations Act and the American Rescue Plan have set the stage for this work. For example, the American Rescue Plan funds bolstering the WHO's COVID-19 vaccination administration efforts help vaccinate approximately half the world's population for COVID-19 within 1 year period, with the U.S. vaccines making their way to key regions of the world where we compete with the PRC for influence. Additionally, the Biden administration has complemented these investments with forward-looking policies that advance U.S. interests abroad. Notably, under President Biden's leadership, the State Department established its Bureau of Global Health Security and Diplomacy, with Ambassador-at-Large Nick Ngang at the helm. Ambassador Nick Ngang, I look forward to hearing from you today about how the Bureau has integrated global health security in our national security and foreign policy priorities, and how the United States is engaging with WHO to advance that effort. So there's certainly a great deal of ground to cover in today's discussion, and it is my hope that today we can identify constructive reforms to the WHO that build on the administration's effort to enhance global pandemic preparedness, as well as forward-looking policies that further cement America's leadership in global health security. So with that, thank you, Mr. Chairman, and I yield back.
Well, thank you. Our witnesses today are Ms. Lois Pace. Ms. Pace is the Assistant Secretary of Health and Human Services for Global Affairs. Ambassador John Nkengasong. Ambassador Nkengasong is the U.S. Global AIDS Coordinator and Senior Bureau Official for Global Health Security and Diplomacy for the Department of State. He worked as the WHO Special Envoy for Africa during the COVID-19 pandemic. And Dr. Atul Gawande. Dr. Gawande is a surgeon, writer, and public health researcher. He is the current Assistant Administrator of the U.S. Agency for International Development for Global Health, as well as board certified in general and endocrine surgery. Pursuant to the Committee on Oversight and Accountability Rule 9G, the witnesses will please stand and raise their right hands. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witnesses all answered in the affirmative. The Select Subcommittee certainly appreciates you all being here today. And I'm sorry we had a delay in this meeting, but we're grateful that you are here today and look forward to your testimony. Let me remind the witnesses, we have read your written statements, and they will appear in full in the hearing record. But please limit your oral statements to 5 minutes. As a reminder, please press the button on the microphone in front of you so that it is on when you speak and so that the members can hear you. When you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow. When the red light comes on, your 5 minutes has expired, and we would ask that you please wrap up your opening statement.